Okay, this morning we are chatting about, it is Black Maternal Health Week here, and we're joined by Syreeta Drake, a mental health nurse practitioner and a member of the Grand Rapids Black Nurses Association, to talk about the challenges, solutions, and what's being done to protect the health of Black mothers. Syreeta, I want to thank you so much for you coming into studio today to chat about this subject. First of all, for those who may not be familiar with this week, why is this so important, and what is this Black Maternal Health Week so important to kind of highlight? Why is it important to highlight?
So thank you for that question. So the Black Maternal Health Week is extremely important to highlight because Black women are disproportionately affected by maternal mortality. They die up to 3 times more often than white women. And by getting awareness out there, and a lot of these deaths and the causes of deaths and mortality is preventable. And so even after you weed out the socioeconomical status of it, they're still disproportionately affected by it.
Yeah, I mean, we can see by the data right here, right? I mean, you can see the categories. We have white, Hispanic, Black, and Asian Americans all on this board here. And you can see the death rates are not just higher, but staggeringly higher there.
Yeah.
Can you talk to, I guess, speak about why it is disproportionately affecting Black women?
So that is a great question. So we are out in the community, of course, trying to get awareness and research. That's because a lot of the underlying conditions, there might be cardiovascular or even mental health conditions. A lot of times they may not even know that they have these conditions already present in the body. And because of that, because of lack of access to care, and just some of those things that tend to affect Black women, such as like hypertension and then the stress, dealing with life and everything, they may not always recognize because of the signs and symptoms. You might have some headache or some swelling or something like that. And so they wouldn't even probably know that it's affecting their pregnancy.
Yeah, I mean, it not only affects pregnancy, it affects childbirth. All of that is connected in some way, shape, or form. As a mental health nurse practitioner, can you talk about how the mental health aspect plays into this? Because I know that our bodies are different than our brains sometimes, right?
Yes.
And of course, I know mental health has to play a role here. So kind of what do Black women go through mentally in addition to how they're disproportionately affected in maternal care?
Well, thank you. That is an excellent question. And so first I want to say, even with all the research and the numbers that you've shown here today, I really would like to impress upon everybody that those numbers are people, which was my passion and my call to go back for mental health, because if you're locked up in your mind, then you're locked up in your life. And so Black women in particular, not only the systemic barriers and racism of the different systems, but not having access to care, not having many providers that look like them, or even understand that paradigm of growing up as being Black in America or whatever system they're in. Those are a few things. And just even the stress of living day to day, even with the current climate and everything that we're going through.
Yeah, a lot of different factors at play, whether that be in healthcare or just life in general. I want to ask you about systemic change. You kind of brought up the system. Can you explain how the system does impact Black women and what needs to be done systemically to kind of change, what needs to change for Black women to be healthier on this front?
Well, this is a great start, having these conversations and being able to be truthful and authentic in the conversation. So that's a part of it. And just getting the awareness out there and being able to have strong community partnerships, because there's so many organizations here that do great work to help with the maternal health crisis, and Black women in particular, but a lot of times they may not even know what's going on within themselves. So even normalizing, taking away some of the stigma associated with mental health conditions, and even some of the chronic health conditions as well. So systemically, making sure that there's equitable access, that there are more providers that look like the people that you're serving, and that there's more awareness and understanding. And with access comes power. And once you empower people, they're not only able to change their own lives, but to change a whole legacy of people coming behind them.
I want to stick on this topic because I think it's important for the folks that don't get it at home. Why is it important for a Black woman to have an advocate in that doctor's office for them? Why is that important?
Well, because they are often operating, and I say Black women, from a couple different systems. So, especially when you talk about the mental health piece. So you not only have to get used to the dialogue of the medical professionals, and many of them not looking like you or understanding some of the ethnicity and some of those innate expressions of being Black that might even be misinterpreted, right? So you need someone to advocate in that realm, and then also just things that we don't think about, like all the linen in the hospital is white so that you can see it. But when you have melanin, you know, and oil in your skin and all of that type of stuff, right? That can come off away. So like even those very basic things of the care and the concern, and not only that, but a lot of times with pain, our expressions of pain may be very different, but physiologically, we all do feel pain. And then even the medical data that's coming out where there have been studies where it's been taught that Black people or Black women don't feel pain like other people, which is not true, right? So all of those things and not being wanted to be labeled as difficult or as pain-seeking or just a complainer. And sometimes what people don't know as far as medical professionals, they might kind of shy away and might not have that strong bedside presence as they would for some others, just because they don't know. So when you have an advocate there, especially one that's versed in medical knowledge and might also understand some of those racial things, they can speak in a way that both sides can be heard, and it can be grounds for collaboration, and not only collaboration, because that translates into safety and better outcomes.
Yeah, definitely. It needs to be a productive conversation for
Yes.
everyone involved, especially when health is at the forefront here. Let's talk about some organizations that are here in our community, the Grand Rapids Black Nurses Association, which you are a part of. And I know that you guys do great work. What are some of the efforts you guys are putting forth to kind of help Black women in their maternal health?
Oh, so we are doing several things in this maternal health crisis that we're in. We are partnering with some organizations. We're doing some focus groups, getting information. We also serve as advocates and have made hospital visits. We're primarily very heavy in the education realm, but also not having a maternal health conversation without also having the mental health conversation. And so because a lot of those things postpartum, like your depression, your anxiety, and even postpartum psychosis, again, you know, we want people to stay here and stay alive and get healthy in their minds. So we're doing that. We're making sure no matter where we are that we are doing like the hands-only CPR and the education and all of those types of things. And then helping like in the doula realm. Making sure that people understand and have advocacy as far as that goes as well. So we have a ton of things that we're always trying to normalize and have those conversations, because the more you have them, sometimes people don't even know that they have questions until they hear you speak or they see you in a space. And so we're pushing, you know, for the doulas and midwifery and just having some collaboration in that space.
Yeah, you were actually answered my next question. I was going to ask you about education and how you guys are spreading that message and spreading that educational topic, and you answered it right on the head for me there. You know, if there's one thing you want people to take away from this conversation this week, you know, this is a week to build awareness about maternal health for Black women. What do you want people to take away from this conversation in the future?
So what I would like people to take away from this conversation is that, again, the numbers represent people. And when people don't have the tools that they need and maybe they haven't been educated, then they are unable to make the informed decisions and they lack empowerment. So the more that we can have the conversations about maternal health and mental health together, then we are raising up a new generation. We're helping to thwart some of the systemic issues and just be out there and be present. And wherever you see the Grand Rapids Black Nurses Association and some of our partners like GRAHI, the Grand Rapids African American Health Institute, which we collaborate with, and also the American Heart Association, these power collaborations really help us to be able to do the work, because within our organization we have highly credentialed and highly skilled nurses covering about every area of nursing. And we do this as an act of love and an act of service because life is so important and people have intrinsic value. So we're ready to change the narrative and knock down some of these disparities.
Yeah, absolutely. Thank you so much for the conversation today. It's one that is important year-round, not just on this week. So we really appreciate your insight, and hopefully some people are able to take away some education from this conversation. Syreeta, we appreciate it.
Thank you.
All right, we'll be back. It's 9:27 after a 2-minute break.